Hello and welcome to the Versa 2018 Employee Benefits Open Enrollment Webcast. If you'd like to view this webcast in a larger format, please click on the full screen icon in the right-hand corner. Also, if at any point you'd like to spend a little bit more time on any of these slides, please feel free to hit the pause button on the bottom left hand of the screen. Over the next 20 minutes or so, we'll be reviewing Versa's benefit program with a focus on the plans for 2018, important dates, and how to make your benefit elections. Open enrollment begins on Monday, November 13th, and concludes on Wednesday, November 22nd, the day before Thanksgiving. This is the one time a year where you can make changes to your benefit elections. The choices you make now will remain in force through the entire 2018 calendar year, unless you experience a qualifying status change, such as a marriage, divorce, gain or loss of a dependent, or gain or loss of coverage. So now is the time to add or drop dependents, add or drop coverage, change plans, update beneficiaries, or change coverage amounts. If you experience one of these events, you are eligible to make corresponding changes to your benefit elections, but you can only do so if you notify Human Resources within 30 days of the status change. Otherwise, you will have to wait until the next annual enrollment period. Please note that this year the enrollment is an active enrollment, meaning that even if you want to make no changes to your benefits, you will still need to go into Benefits Connect and make those elections again. New for 2018 is Versa's early enrollment contest. When the open enrollment period begins on November 13th, those of you that enroll within the first 3 days will be eligible for a drawing to win an iPad. Open enrollment period will end on Wednesday, November 22nd, and all of these elections that you make will take effect on January 1st of 2018. Included in the email that had the link to this webcast is an additional link to an introductory video from Versa's CFO, Bob Trular. Please take a minute to watch this video prior to us diving into the details of Versa's open enrollment. So remember, you have until 11:59 p.m. on Wednesday, November 15th to enroll in your 2018 benefits to be eligible for the iPad drawing. While there are no changes to any of the medical plans going into 2018, there will be a slight increase to medical premiums of all three plans for 2018. This includes the Gold High Deductible Plan with the Health Savings Account available to all employees, the Platinum PPO Plan available for all of those Versa employees not in Louisiana, as well as the Platinum HMO Plan for all of the Louisiana Versa employees. There will be no benefit changes and no changes to the premiums on the dental, vision, or life insurance plans. For 2018, Versa is introducing a spousal surcharge to all of the medical plans. If your spouse is eligible for medical coverage with their employer, but you still choose to enroll them on one of Versa's medical plans, a $50 surcharge will be added to your per pay period payroll deductions for a total of $100 per month. Now I'd like to turn your attention to this high-level benefit summary table. As you can see, there will be no changes to any of the carriers that provide your current benefits. The medical plans are still provided by Blue Cross Blue Shield of Louisiana, and the dental carrier is still Delta Dental. Lincoln Financial will continue as the provider of the vision plan, the life and optional life insurance, as well as the optional critical illness and accident policies. Gulf Coast Savings Bank provides the health savings account, and Ameriflex is the administrator of the flexible spending accounts. We have listed contact information for all of these carriers here, so please feel free to pause the webcast here if you need to write down any of this information. In order to enroll in your benefits, you will need to go to the Benefits Connect website listed here. Once on the site, please log in with your ID and password. Your user ID will be the first 6 letters of your last name, combined with the first initial of your first name, and then the last 4 digits of your Social Security number. Your password will be your full Social Security number. Once you've logged in, we ask that you go onto the site and verify that your information is correct. Please confirm that your mailing address, email address, phone number, dependents, and any beneficiary information are all correct. If they're not, please make any changes necessary. Then please go in and choose and review your benefit elections. If any additional forms are needed to complete your enrollment, print them out, sign them, and return them to your local Human Resources contact, which we will go over later in this presentation. We'll begin our benefits overview with the current medical plans for 2018. Here we have a summary of the Gold High Deductible Plan with the HSA and the Platinum PPO and HMO plans. All of these plans provide annual preventive care at no charge, and all provide in and out of network benefits. Please be aware that the in-network benefits yield greater protection and a much lower out-of-pocket cost for members, so the summary on the screen here focuses only on the in-network benefits. While there are no changes to the benefits from 2017 into 2018, there are differences between the two plans being offered to each employee. The main difference between the plans is that the Platinum PPO and HMO plans have a lower deductible amount and copays, but is more expensive in terms of payroll deductions. So it's important to consider your own personal circumstances and anticipated medical care when making your plan selection for 2018. The new employee contributions for both plans are listed at the bottom of this benefit summary. Please be aware that these contribution amounts are exclusive of the $100 monthly spousal surcharge. When making the choice between the two medical plans, you need to be aware that while there are big differences in the benefits being offered between the two plans, there are also significant premium differentials as well. This slide highlights the differences in the premiums to help you decide which plan is the right choice for you. Again, please remember that all of the annual premiums amounts listed here do not take into account the spousal surcharge, which would be an additional $1,200 per year, or any possible contributions you might make to your health savings account if you are enrolled in the Gold High Deductible Plan. The next two slides will go into different scenarios and the costs that would be associated with the plans. In the first scenario, we are going to assume a plan for an individual on the employee-only tier. This person would anticipate going for their annual physical, which would be covered at 100% on both plans. We would assume one trip to see their primary care physician, 2 trips to see a specialist, and a few generic prescriptions. We'll throw in a few tests and an urgent care visit as well. When we total these expenses, the PPO plan seems to come out on top with an out-of-pocket cost of $699 versus $1,150 on the high deductible plan. But we also need to factor in the annual payroll deductions. Once we do this, the high deductible plan will cost this particular individual $2,975, while the Platinum plan will cost them $3,777. In the second scenario, we're going to be looking at a plan for a family. This family of 5 would anticipate going for annual physicals, all covered at 100%. We're going to assume a total of 9 trips to the primary care physician, 5 specialist visits, and a few prescriptions. After a few tests and an urgent care visit, they would pay $1,257 on the Platinum plan and almost $2,800 on the high deductible plan. But again, once we factor in annual payroll deductions and the amount of money that this person paid out of pocket, the high deductible plan would end up costing his family $7,972, and the Platinum plan would cost $10,964. Remember, this family scenario does not include the spousal surcharge in the premium amounts, and it also does not factor in any contributions to their health savings account, which could offset even more of the high deductible plan costs. When Versa employees choose the Gold High Deductible Plan, they are able to enroll in a health savings account or an HSA. Any HSA contributions you make are deposited into an account that you own and can be used by swiping a debit card at the point of purchase. This allows you to contribute pre-tax dollars to fund out-of-pocket medical expenses. If you choose to open and contribute pre-tax dollars to an HSA account, you can use those dollars to pay for out-of-pocket expenses during the year, or you can save that money for expenses down the road, such as retiree health care. You may even use your HSA dollars to help pay for dental and vision claims. And the most important aspect of a health savings account is that unlike flexible spending accounts, there is no use it or lose it penalty. There are some eligibility rules for health savings accounts. Only those Versa employees that enroll in the Gold High Deductible Plan will be eligible to have the HSA. Any employee that chooses the Platinum PPO or HMO plan will not be able to elect the health savings account. Any individual that is currently enrolled in Medicare or is currently being claimed as a tax dependent on someone else's tax returns is also ineligible to participate in the health savings account. The new contribution limits are $3,450 for an individual and $6,900 for a family. For those of you over the age of 55, you will be allowed to have what's called a catch-up contribution, raising your allowable contribution limit by $1,000 up to $4,450 for an individual and $7,900 for a family. Remember, there is still a 20% penalty for any non-qualified expenses. If this is your first time to choose the Gold High Deductible plan and you're interested in starting an HSA, please complete and return your HSA enrollment form to your HR department prior to the end of open enrollment. Healthcare flexible spending accounts are another great way to put aside tax-free contributions. The IRS has raised the available maximum for FSAs up to $2,650 for qualified expenses. These include medical, dental, and vision expenses, as well as prescription drugs and alternative medicine. These funds are available to you on the first day of 2018. Just remember, you must go into Benefits Connect and re-enroll for the 2018 plan year. Dependent care FSAs allow you to set aside funds to pay for any qualified expenses incurred by eligible dependents, children, or the elderly. The annual maximum for the dependent care FSA will remain at $5,000, and the funds are available to you as they are deposited throughout the year. You will need to go into Benefits Connect to re-enroll and elect the amount of money you would like to set aside for the dependent care. This high-level summary shows the differences between the HSA and the FSA. While the HSA will only be available to those employees that enroll in the Gold High Deductible plan, the FSA is available to employees in both plans. If you decide to enroll in both the HSA and FSA, the healthcare portion of the FSA will become a limited purpose FSA, meaning that it can only be used for dental and vision expenses. New enrollees in the HSA plan are required to fill out a form and submit it to HR, while there is a mandatory re-enrollment for all flexible spending account elections. The HSA is your account, and the money in it rolls over year after year. The FSA has a $500 rollover provision, giving employees until March 15th of 2019 to spend that amount before having to forfeit the funds, as the FSA does have the use it or lose it penalty. The annual maximum contribution amount on the HSA is $3,450 for an individual and $6,900 for a family, while the FSA maximum will be $2,650. Now let's move on to the dental plan, which continues to be offered by Delta Dental for 2018. The plan will pay preventive services at 100% and includes each covered member teeth cleanings twice a year and one set of x-rays. Basic services are covered at 80% and major services at 50% until you hit the annual maximum of $1,500. Orthodontia for children is also covered under the plan and includes a separate $1,000 lifetime maximum benefit per child. As we mentioned earlier, there is no change to the dental premiums for 2018. Next up, we have the vision benefits, which will continue to be offered by Lincoln Financial under the Spectera network. The benefits are not changing this year, and the plan still includes a $10 copay for an eye exam and additional copays which cover the cost of glasses or contacts when accessed through an in-network provider. Lenses or contacts are available once per calendar year, and frames are available every 2 years. As with the dental, the vision premiums remain the same for 2018 as well. Let's shift gears now and turn to the life and disability benefits, which also continue to be offered through Lincoln. As a full-time employee of Versa, you are automatically covered for 1 times your annual salary in basic life and AD&D insurance, up to a maximum of $175,000. These life and AD&D benefits are provided at no cost to you, and at the time of your death, the money will go to your assigned beneficiary. If you'd like to purchase additional life insurance or AD&D coverage, you can buy up to 5 times your annual salary of up to $500,000 in increments of $10,000 through the convenience of payroll deductions at attractive group rates. You can also purchase coverage on your spouse and children. If you are newly eligible for benefits, you have a one-time opportunity to enroll for life insurance coverage of up to $150,000 for yourself and up to $30,000 for your spouse without any medical questions. If you're already covered under this plan, you can keep the same amount without having to answer any medical questions. You are also allowed to elect an additional $10,000 in voluntary life insurance 2 separate times without having to answer medical questions or evidence of insurability. The rates for voluntary life insurance coverage remain unchanged in 2018. The next slide focuses on 2 types of voluntary disability insurance which are offered to employees of Versa. These 2 plans are also offered through Lincoln, and they are designed to work together to provide seamless disability protection in the event you are unable to work due to accident or illness. The short-term disability plan pays for off-the-job accident or illness-related disabilities, and after a 14-day elimination period, it will begin to pay a benefit of 60% of your salary, up to a weekly maximum of $1,500. This benefit begins on day 15 of the accident or illness and will continue for 90 days, at which time the long-term disability plan will begin to pay a benefit. It has a 90-day elimination period, meaning that the long-term disability plan begins on day 91, which is satisfied with the completion of your short-term disability. The long-term disability replaces 60% of your salary up to a monthly maximum of $8,000, and that benefit will continue as long as you are disabled, up to your normal retirement age. If you are out on a claim for any disability, you would continue to receive this benefit even if VRSA cancels the policy. So this is a very valuable benefit to protect your income in the event of disability. Note that during open enrollment, you can enroll in short and long-term disability without submitting evidence of insurability, regardless of whether you previously waived coverage or not. Also, please be aware there is still a pre-existing condition limit where if you are being treated for an illness or an accident in the 3 months prior to the plan taking place, you will not be covered for the 2018 plan year. In addition to offering a comprehensive traditional employee benefits package, VRSA also offers a couple of supplemental voluntary benefits that I'd like to tell you about. The first is accident insurance and will pay you a specified amount anytime you have a covered accident. Some of the benefits include emergency treatment, dislocations or fractures, medical appliances, health screenings, or being in the hospital. All payments are made directly to you and are in addition to your medical benefits. This type of accident insurance is especially helpful for those employees and families with active lifestyles. Evidence of insurability is not required, and this accident insurance does not cover work-related accidents, as those types of incidents would fall under workman's comp. One benefit of the accident policy is a $50 benefit that is paid to you for completing a health assessment. These benefits are covered at 100% under the medical plan, so this is something to consider when deciding if the accident policy might be right for you. The second supplemental policy is critical illness. This will pay you a lump sum amount to help with out-of-pocket expenses for certain covered diagnoses. Some of these include, but are not limited to, heart attack, stroke, cancer, end-stage renal disease, ALS, or organ transplant. Coverage options are $10,000 and $20,000 for the employee, $5,000 or $10,000 for your spouse, and children are eligible for 25% of the employee's election and are free to add to the plan when the employee elects coverage for themselves. Like the accident policy, there is also a $50 benefit that is paid to you for completing a health assessment. The Employee Assistant Program, or EAP, is available to VRSA employees at no charge. The EAP program is offered through Lincoln and provides confidential, unlimited 24/7 telephonic support for issues ranging from parenting, legal services, financial stress, to even the loss of a loved one. The program also includes up to 4 free face-to-face counseling sessions, and if additional visits are necessary, they will work with you to find an in-network provider that will work with your Blue Cross Blue Shield of Louisiana medical plan. Travel assistance is also provided at no cost to you. This benefit comes in handy while traveling abroad if you need emergency services. Medical referrals and evacuation assistance, if necessary, can also be provided. For instance, if you were on a cruise and had to be taken off the ship for medical services and were unable to make it back before leaving for the next port, the Travel Assistance Program would help you get home and help pay for those additional travel expenses. The VRSA Benefit Advocate Center is a fantastic resource that all employees can utilize for any questions that might come up during open enrollment. From questions about enrollment choices to claim issues to helping you find an in-network provider, the BAC has your back. They're open year-round from 7:30 a.m. until 5:30 p.m. Central Time, Monday through Friday. Please feel free to reach out to them either by phone at 1-844-610-1974 or via email at bac.versaintegrity@ajg.com. Please remember to call the Benefit Advocate Center and not the VRSA Help Desk for any open enrollment questions you may have. Well, we've come to the finish line of this benefits overview, but I want to take a few minutes and re-emphasize some important dates, enrollment instructions, and where to go if you have questions. You must enroll in the Benefits Connect program by logging into the system at www.enroll.benefitsconnect.net. Remember, your username is the first 6 letters of your last name, followed by the first initial of your first name, followed by the last 4 digits of your Social Security number. Your password is your full Social Security number. Remember, even if you want to make no changes to your current elections, you must go into Benefits Connect and make elections anyway. And also, open enrollment is from Monday, November 13th through Wednesday, November 22nd. If you have any questions or still need help enrolling in your benefits package for 2018, please feel free to reach out to your local benefits specialist. For those of you located in Beaumont, all of the Florida locations, or Sulphur, please reach out to Melissa Brown at 337-313-4690. Those of you with CSI, Corpus Christi, Freeport, or Houston locations, please contact Shannon Clement at 281-520-3122. And those of you in Baton Rouge, Lafayette, Gretna, or Moss Point, please call Leila Sylvester at 504-368-3122. Remember that to be eligible for the early enrollment contest and the iPad drawing, you must select your benefits by 11:59 p.m. on Wednesday, November 15th. This concludes the VRSA 2018 Open Enrollment Employees Benefits webcast. Thanks for listening.